Okay, now I'm going to do my image evaluations. This is a PA axial projection, Caldwell method. The Merrill's evaluation criteria for this image is we need to have evidence of proper collimation, and on this image it's good collimation. Entire cranium without rotation or tilt, which is demonstrated by equal distances from lateral borders of skull to lateral borders of orbits on both sides, symmetric petrous ridges, MSP cranium aligns with long axis of collimated field. PA axial Caldwell demonstrates petrous pyramids lying in the lower third of the orbit. PA projection shows orbits filled by petrous ridges. That's the difference between PA and PA axial. Entire cranial perimeter showing 3 distinct tables of squamous bone. Penetration of frontal bone with appropriate brightness at lateral borders of skull. The structures shown on this image is for PA projection with a perpendicular CR, the orbits would be filled by the margins of the petrous pyramids. Other structures shown include the posterior ethmoidal air cells, crista galli, frontal bone, and frontal sinuses. The dorsum sali is seen as a curved line extending between the orbits just above the ethmoidal air cells. When CR is angled 15 degrees caudad to the nasion for the PA axial projection, Caldwell method, many of the same structures that appear in the PA projection are seen. However, the petrous ridges are projected into the lower third of the orbits. The Caldwell method also shows the anterior ethmoidal air cells. Central ray for this image is directed to exit the nasion at an angle of 15 degrees caudad. To show the rotundum foramina, we're going to direct the CR to the nasion at an angle of 25 to 30 degrees caudad. To show the superior orbital fissures, we're going to direct CR through mid-orbits at an angle of 20 to 25 degrees caudad. We're also going to center the IR to the central ray. The IR that I used for this projection is 10 by 12 inches lengthwise. SID 40 inches, and breathing instructions was suspend respiration. My technique was 85 kVp at 14 mass, and you want to shield the patient as much as possible, and I did that too. This image is a lateral projection, a right or left position. This is a right position. For my trigger, I did left position. Merrill's criteria for this projection is evidence of proper collimation, and we have that on this image. Entire cranium without rotation or tilt, we see the whole thing, and it's not rotated or tilted. And it is also demonstrated by superimposed orbital roofs and greater wings of sphenoid, superimposed TMJs, superimposed mastoid regions, and EAMs, and sella turcica in profile. So sella turcica, superimposed EAM, TMJ, the rami, orbital roofs, and greater wings of sphenoid. Penetration of parietal region and no overlap of cervical spine by mandible, and we do not have an overlap over here, so it's a proper image. Structures shown on this image are this lateral image of the superimposed halves of the cranium shows the detail of the side adjacent to the IR. The sella turcica, anterior clinoid processes, dorsum sali, and posterior clinoid processes are well shown in the lateral projection. Central ray for this projection is perpendicular, entering 2 inches superior to the EAM. it's going to be centered to the IR. No, we're going to center the IR to the central ray. The IR for this projection was done by 12-inch crosswise, SID 40 inches, breathing instructions are suspend respiration, and my technique was 85 kVp at 6.3 mass. And you also want to shield the patient as much as possible. This is a submentoverticular projection SMV Schuler method. Merrill's evaluation criteria for this image is we need to have evidence of proper collimation, and we have proper collimation. We need to see entire cranium without tilt demonstrated by equal distances from the lateral borders of the skull to the mandibular condyles on both sides. Symmetric and symmetric petrosy. IOML is parallel to IR, which means that we have full neck extension, and that's demonstrated by mental protuberance superimposed over anterior frontal bone, mandibular condyles anterior to petrosy. Brightness and contrast sufficient to demonstrate cranial base anatomy. SMV projection of the cranial base shows symmetric images of the petrosy, the mastoid processes, the foramina ovale, and spinosum, which are best shown in this projection. The carotid canals, the sphenoidal and ethmoidal sinuses, the mandible, the bony nasal septum, the dens of the axis, and the occipital bone. The maxillary sinuses are superimposed over the mandible. SMV projection is also used for axial tomography of the orbits, optic canals, ethmoid bone, maxillary sinuses, and mastoid processes, with a decrease in exposure factors. The zygomatic arches are also well shown in this position. Central ray for this projection is directed through the sella turcica perpendicular to the IOML. The central ray enters the mid-sagittal plane of the throat between the angles of the mandible and passes through a 0.34 inch anterior to the level of the EAM. Center the IR to the central ray. The IR should be parallel to the IOML. The IR I used was 10 by 12 inches lengthwise. SID was 40 inches. Breathing technique was suspend respiration, and my technique was 85 kVp at 28 mass. And we also want to shield the patient as much as possible. And I meant breathing instructions was suspend respiration. So we can see maxillary sinus, ethmoidal cells, mandible, sphenoid sinus, foramen spinosum, mandible condyle, dens, odontoid process, petrosa, mastoid process, and occipital bone. This is an apiaxial projection Townes method. Merrill's evaluation for this projection is we need to have evidence of proper collimation. We have to be able to see entire cranium without rotation or tilt, and it's demonstrated by equal distances from lateral borders of skull to lateral margins of foramen magnum on both sides. Symmetric petrous ridges, mid-sagittal plane of cranium aligned with long axis of collimated field. Dorsum sali and posterior clinoid processes visible within foramen magnum. Penetration of occipital bone with appropriate brightness at lateral borders of skull. The apiaxial projection shows a symmetric image of the petrous pyramids, the posterior portion of the foramen magnum, the dorsum sali, and the posterior clinoid processes projected within the foramen magnum, the occipital bone, and the posterior portion of the parietal bones. This projection is also used for tomographic studies of the ears, facial canal, jugular foramina, and rotunda foramina. Central ray for this projection is directed through the foramen magnum at a caudate angle of 30 degrees to the OML or 37 degrees to the IOML. The central ray enters approximately 2.5 inches above the glabella and passes through the level of EAM. IR is 10 by 12 inches lengthwise and SID was 40 inches. Breathing instructions are suspend respiration, and my technique was 85 kVp at 14 mass. And for this image, we also want to shield as much as possible. So in this image, we see parietal bone, occipital bone, foramen magnum, petrous ridge, posterior clinoid process, and dorsum sali.